I tell people that sometimes I think there's sort of two components to heart surgery lifestyle. I mean, one component is the sort of the physical life itself, the fact that we start early, we work late. There's times when we're on call. You know, my days start at oftentimes at, I'll wake up at 4 a.m. or 4:30 a.m. and then work all the way, into the 7 or 8 o'clock night. And that's multiple hours of standing, and of course, I've been doing it for years and years. And so there's kind of the physical toll of being a heart surgeon, but then there's sort of the emotional intensity of it that you alluded to. And I think that's very interesting because I tell people that, particularly young surgeons that are starting out, that you would think that gets easier, but actually that gets harder as you get more experience, because what ends up happening is that as you become more experienced, you end up operating on sicker patients where no one else can do it except for you. And so every surgery becomes more intense. And then, of course, sometimes you operate on people people who you work with. I've operated on colleagues, on family members of colleagues. A lot of times my colleagues will ask me to operate on their mother or their father. And of course, that adds a whole other element of pressure when you sort of know the person. And so I think that to do that day in and day out, you have to find the balance and make sure that you can free your mind and come up with ways to relax yourself, because otherwise it would get very, very intense.